Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, we're joined by Jason Ward, co-founder and CEO of EQL. And today we're talking about the role of digital health in this area of musculoskeletal care, particularly in Australia and around the world too. Jason, g'day. How you going?
Yeah, good. Thanks for having me, Peter.
So good to have a chat on the show. I feel like last time we spoke, I'm pretty sure it was in Amsterdam or some, neutral part of the world.
Yeah.
But it's been a bit since we've
equidistance, right?
Yes, that's right. But no, look, keen to dive in, learn a bit more about EQL, learn a bit more about MSK and the role it plays in all of that. But first, maybe if you could introduce yourself, tell us a bit more about you and what you do, and we'll learn about EQL as well. I'll start there.
Yeah, thanks. So, hi, Jason J. It's fine. Co-founder CEO here at EQL. So yeah, my background's as tends to be the case of kind of entrepreneurs within healthcare, is varied and follows a windy path. I started in financial services actually, and did 8 years as a commodities broker, split between London and Geneva, and then kind of came back from Geneva a bit disillusioned with kind of just making money for the sake of making money's sake and staring at spreadsheets and things of that sort. And I tell this joke a lot, but ironically, I stare at spreadsheets a lot nowadays, as much as I probably did back then. But hence is the role of a CEO. Actually, my parents are both in healthcare. So my mum's a nurse, just retired, and my stepfather is a GP. So they're kind of frontline, saw the impact that not only MSK had in terms of kind of the front door, but just generally across kind of access into healthcare, and how specifically in the UK we have unique problems of we don't have a funding issue in regards to people funding their own healthcare necessarily. It's free point of access, but as a result of that, the world and his wife is trying to get access to that healthcare, and that causes problems. And so seeing that kind of prompted literally a kitchen table conversation. There's that old adage of kind of build your startup on a kitchen table, but we literally, me and my stepfather, my first startup looked at primary care, and then raised some money from a large hospital group based in London, and kind of launched what was a primary care disruptor back then, and then got eaten alive, honestly, by what was effectively the new kids on the block, people like Babylon, we all know that name, and their cost of acquisition and their proposition. And we were obviously using Google adverts and Facebook adverts and things of that sort, Meta adverts and things of that sort at the time, and we couldn't compete. This is the honest truth, because we were a face-to-face primary care brand, and so that rolled out kind of over 3 years. And then I went and joined kind of the perceived enemy of the face-to-face world, which was remote GP, and joined a remote GP business for 2 years. I think it was there. It started off as a management consultant, and then kind of went in as head of corporate development, bit of head of innovation type role, and then met my co-founders. And ex-entrepreneurs do not make for good employees, just as a highlighted fact. Putting people next to each other that still have an itch. My co-founder, Pete Grimberg's, built a previous business within physiotherapy and had built his network. He built a network business, so physical clinics, scaled it, and then kind of exited into the same group that I was part of at the time as well. And the two of us kind of very much still wanted to build, still wanted to see technology driving access, and seeing clinicians not necessarily as a gatekeeper to access, but restricted by the fact that the capacity and the fact that there isn't enough of them. And a lot of NHS clinicians are working their proverbial butts off day in and day out to try and deliver high capacity delivery, delivery of care, but there just physically isn't enough of them. The system is built around a funding model that doesn't support high innovation, high growth, or at least it's getting better, but it wasn't there kind of, especially when we were looking at this. And so we founded EQL back in 2019 with some very supportive investors in Handel Group, who then kind of we went on a journey with to look at democratizing and kind of opening the door to MSK support. So yeah, that's the journey to date. I've gone grayer in the process. And I'm
Yeah.
not bald under here, I promise, but I
Yeah, yeah.
have tended to end up on a hat and trying to hide the greys more than necessarily the receding hairlines.
I was going to say, for those watching the video of this episode, no, it's not a prerequisite to wear a black cap to be on the Talking Health Tech podcast, but I'm glad
Told me I had to wear
you
it.
did
Told
match.
me I
Yeah.
had to wear it. I
But
wasn't getting on unless I wore it. That's the
yeah,
point.
yeah, yeah. And it's cute. It's cute. Yeah. So based in the UK, but then we'll learn about the kind of global reach in a little bit there. And for those just listening, so equal spelled EQL. So got the kind of background and context and the kind of lead up to here. So tell us about the what equal does and like what it is.
Yeah.
It was what the problems it solves. Yeah.
So equals tongue-in-cheek play on kind of accessible, equal access for all, with a bit of a sequel play. And ultimately this idea that if you can, using technology, open up the doors of, and bear in mind, this is 6 years ago when we started this, but I think the idea and the premise is ever more relevant nowadays. Can you take technology, apply a load of information and using that information, disseminate that information to vast amounts of people, helping them empower themselves to get better healthcare, to manage their own healthcare, and ultimately scale up the clinician effectively is what we're trying to do. So we are not ideological in regards to digital, like especially within MSK or musculoskeletal. It's pretty clear that there is going to be a proportion of those patients that need hands-on treatment. And that we are not at the world yet of a robot coming to your house and manually massaging your thigh. And thankfully that hopefully is a world that we don't see. But we see definitely, like, we have in-house clinicians. We work with partners that have scaled teams of clinicians, especially globally. In Australia, we work with some great partners we'll talk about in a bit, that are humans, thankfully, and are great clinicians and are delivering great care using our technology to scale what they do and deliver higher capacity, because the tools that we provide and build allow them to do more with what they know. And so when we first came into kind of looking at Equal, it was building out Theo as a treatment provider, like assistant effectively. So delivering prescriptive rehab plans, being able to help people empower their journey in regards to understanding their pain, their sleep, and ultimately get them from day zero through to healthy outcome. What quickly became kind of realism is, how do we get them in? Like, how do we find out that they're appropriate? How do we kind of access large kind of entry points to a healthcare system where it's fragmented? You've got rural versus urban centers where, might be able to get somebody in for an assessment, but realistically they might live miles and miles and miles away, or they might be suffering with MSK conditions, which then is not the most painful thing to be able to get on a bus or getting a taxi or however it is they go traveling around. And so we built the next part of our product, which was triage, and Theo Access is very much our linchpin product now. It kind of, we do, I think it's 25,000 triages a month now through that product. Bear in mind, it's a human / technology kind of play. We're very much not handing over yet. We're close, but we're not yet handing over large amounts of that work to just the technology. At the moment, our human clinicians, I keep saying the word human clinicians because I think there's a lot of talk at the moment about AI clinicians, and therefore it's making that really clear distinctions that we are still using humans without sounding like a sweatshop or without sounding like a factory operation, but we use humans to do our work here. And so, but we're scaling, like we're 1000xing the ability of those great clinicians that we both employ or partner with to be able to deliver great care using technology. And so, we've scaled the platform from our initial two products, like Theo Engage being kind of the treatment aspect or rehab prescription pathway, through to having access, which is now triage, to now moving both downstream and upstream. So we do face-to-face everywhere we go now. We deliver thousands of sessions of face-to-face through our partner networks. And we also then go further down. So we do outcome data collection. So one of the big things that we kind of wanted to own as a business was we do what we say we do, and we deliver good care and we deliver outcomes that are positive and also that deliver ROI. So in other words, a return on investment. Like there is no point building businesses in healthcare that just make people better, because as much as I, as a purist, would like to think that those get scaled, they don't get scaled, because who's paying for them and where do they get paid from? And ultimately, I think a lot of the problems that we see in health tech and generally healthcare, I think, is that people don't build for something that's sustainable. They don't build for something that's going to solve the problem you're trying to solve. Yes, but one of the biggest problems in healthcare is who funds it and who pays for it and how is it paid for. And unless those things are addressed, things don't get scaled. I wish the drug that you could design that solved everything for everybody was available. It's not, but even if it was, it would need to be cost effective still to be able to be rolled out. And so I think, especially in the UK, where we have a unique funding scenario within the NHS, where there is a pot of money available for an ever increasing amount of need, those things that you come to the table with from an innovation point of view have to be sustainable. They have to be cost effective, and ultimately they have to deliver both great clinical outcomes but also great economic outcomes. They have to deliver ROI, or they just won't get scaled.
No, 100%. And so it sounds like PHIO, so PHIO is the kind of like central piece, but they've got that triage part to it too. And you mentioned that, so, what sounds unique is you've got both, it's not just a technology solution platform thing, but you've got you mentioned you employ clinicians too. So, yep. And, but also partnering with other groups, and there's an in-person element as well. And so to that point then, because that was the next question I was going to ask, like, so is this a, patients find it on the app store and direct to consumer type approach, or is it a partnering in with the healthcare systems? What's the go to market, I guess?
So it's definitely B2B. Like we don't really do anything B2C directly. So there's this weird thing of B2C to like B2B to C, basically. We build our technology for patients. We don't build them for clinicians necessarily. We don't build them for payers either. We build them for patients, because ultimately patients need to use our tools to get better. That being said, we still need to have a clinician using our technology that's going to be able to see the data in real time or be able to action that data. So therefore we have to build stuff that works for them. But ultimately I'm not building an AI scribe that sits to help somebody write some notes in a clinician environment. I'm writing something or building something that the patient feels an aha moment as quickly as possible to be able to empower themselves on that healthcare journey. I think also when we look at our business model, we are very much a health tech plus service provision. So yes, we have in-house clinicians, and they're not just there for the sake of like writing code or checking code. They are delivering clinical hours and hours. And I had an interesting call with one of my co-founders yesterday, Samantha, who's our chief operation officer. And we were looking at what is it FTE per 100,000 lives that we cover? Because we have to take that into a real consideration. It's like how many clinicians do we need to be able to service different demographics of a marketplace, because we look after really wide varying populations, from insured through to rail workers, through to police force, through to NHS workers themselves, through to patients of the NHS. And those all have very unique entry points, very different claim utilization risks. And so it scratches my nerdy maths backgrounds of looking at how much kind of are people going to claim or enter the system. And I think that's why uniquely, maybe not being a clinician has helped our business in my role, at least. We've got great clinical leadership in Pete, my co-founder, Grimberg, who's a physio by background. We've got great kind of operational leadership in Samantha, but ultimately my brain is focused on commercial ability of the business, sustainability, as we were talking about just now, but also then looking at things like the nerdy side of the numbers and how those numbers play into being able to build sustainable models and scale our technology as well.
And you mentioned, there's the nuances or the intricacies of the NHS and doing business in the UK and scaling out there. And it sounds like you've got, the solution there and the funding model and the product to scale in that market. I'm curious what you know about the challenges in the Australia market. What are the challenges that the healthcare system in Australia face? And you mentioned two payers, because it's not just the hospitals and the clinics or the allied side, is it? Is like employers that also have things to worry about too.
Yeah, so it's a learning curve, Australia. There's similar challenges, and then there's very unique challenges. Similar challenges are that, you have an access problem a lot of the time, in the sense that specifically within your rural communities, and we see that within our Scottish contracts, for instance. Like we work with the Highlands contract in Scotland. We also work on the islands of Shetland and Orkney, which are literally miles, if not hundreds of miles away from certain services. And so when you come to Australia and you look at some of the rural populations that you have, you have an access problem. And then it's sometimes prohibitively expensive to be able to get access as a result of either the rural distances or the fact that there is sporadic clinics dotted around, and therefore you're going to have an access problem. 1 in 3 Australians are suffering with an MSK condition. That's not too dissimilar to what we're seeing in the UK, and actually globally from a 2 billion MSK problem. That is a stat that gets thrown around a lot, and is a highlight to this problem is not unique to any country, realistically. The human body in its frailty is going to deteriorate over time, and whether that's an acute injury early on in your life or it's just the time of the body getting older. And I mean, we see it in our stats. Our average age is in their 50s, and that's just naturally by the sense of the body is going to get older and therefore come across more MSK conditions. And I think in Australia, the funding model is quite unique in the sense that a lot of the work that we've done so far and working with our partners. So in terms of partnerships and things of that sort in Australia, like we work with Mercer's team. We've done an initial Australian-based pilot for the last 12 months now, with a global leader in HR. And that was a real eye-opener for us. It was important for us to obviously deliver kind of a pilot in Australia but working with Australian patients and seeing Australian data on the ground. The results of that have been fantastic. We've seen 14 to 1 ROI going to that ROI point. So for every dollar spent, $14 mitigated, which is huge. NPS was through the roof. And generally, I think that pathway is really interesting for us, is this idea that, we were focused on a workers' comp type of pathway, a workers' compensation pathway, which is a unique proposition to the Australian market in the sense that we hadn't really come across workers' comp. It's similar to our income protection here in the UK, but it is different in the sense that it's much more regulated there. It's much more mandated in Australia in regards to having, whereas it's optional here, obviously in the UK. We have the NHS. You don't have an NHS. That's kind of payer funded or worker funded. And so I think it's been an uphill kind of learning curve in regards to the Australian market, but unique challenges. Patients are patients ultimately. And what we're seeing is they're engaging with the technology. They're getting great outcomes. And actually the ROI is probably better in Australia than we're seeing in the UK market. And that probably is more to do with the fact that we have been beaten up by the NHS on price over the last years, in the sense that they have a lot of buying power, the NHS, and therefore we have to build stuff very, very kind of sustainably, I'd say is probably a better word than using cheaply. But we have to kind of keep within a cost envelope that allows for rapid scale within the NHS, because they're driving technology adoption at scale, and therefore with a funding pot that is obviously not always at scale. But within the Australian market, there is a bit more money available. However, it has to be used appropriately and it has to deliver good ROI. And what's great is that the pilot results for the first pilot anyway that we've just completed have delivered brilliant ROI. So we're really pleased with that, and good outcomes clinically and all of those kind of things. So got people back to work, and that's ultimately what the tool's there for. So
I was going to say, that makes a lot of sense to me in terms of having a digital solution to help address the issue of access. And Australia's big geographically, and we're spread out, and we don't use the middle bit of it. And the it's too hot. And the but then you can't just demonstrate that the major return on investment of a solution is that you're giving people access to solution, because telehealth has been around for a long time. So in terms of, you mentioned like at the end there, the better clinical outcome. Like, so walk me through like what how you think about the patient impact, or how you measure that kind of impact from a patient point of view, other than just making sure they can speak to a clinician or engage with the healthcare system online.
Yeah, for sure. So I think one of the unique parts of what we do is, compared to telehealth, for instance, because you're right, like why is telehealth not delivering the same results as, for instance, we deliver, or any other kind of health tech solution sometimes delivers or doesn't deliver sometimes. And ultimately that's about guided access, and it's about making sure that not only are you delivering technology that people are engaging with, but also it's on their terms, and it's in their frame of mind within the MSK space. So like I could put a physio on a video call at any point of the day, like maybe you want it 24 hours, but ultimately MSK doesn't get kind of fixed, and these conditions don't get solved on the call in that moment. This, especially within kind of musculoskeletal, and I'm not a clinician, as we mentioned, but musculoskeletal conditions get solved over periods of time. It's about repetitive treatment. It's about making sure that you're keeping up with your exercise programs that are being prescribed by your physio to continue with, and ultimately engaging in your own healthcare so that you're eating well, you're sleeping well, you're hydrating well, but you're also doing your exercises. And those things don't get done on a phone call for 30 minutes with a clinician. They may get talked about, but they're not happening in the moment. With technology, you have this ability to build habitual loops. You can build nudge notifications, you can remind, you can push, and ultimately you can hold to account somebody to adhere to their program of exercise, making sure that they're hydrating, making sure that they're sleeping right, and ultimately collecting data at the beginning and during and end of that journey that then impacts our understanding of how that journey has happened, how that recovery has happened, so that the next 10,001st patient that comes along, we've built better systems to deliver better care for that patient, because we've learned from that journey, basically. And the issue with one clinician speaking to one patient at a time is, how much do you think that clinician can learn? That's 10,000 calls he has to make effectively to learn the same as what Theo's learned in 2 weeks of seeing 10,000 patients, basically. And so I think, and to the point when we talked about it at the top of this call, it's about scaling that clinician's ability. It's about saying, we want you to deliver what you know and how great you are as a clinician at scale. And how do you do that? Well, you can't do that. You can't hold a 10,000 person telehealth call. I mean, it would be an interesting one to try. I mean, your platform's probably as great as ever. Just to stick a doctor on there and see if you can get 10,000 people with an MSK condition that matches across it and deliver that at scale. But funnily enough, the world doesn't work like that. And so we're seeing that with technology plus clinician kind of delivery mechanisms, you can deliver great outcomes at scale, and then ultimately engage that patient on their journey throughout the journey, rather than just a moment in time that effectively is what a telehealth consultation delivers. It's a moment in time with great advice and great support on that 30 minutes. And they may keep up with that, but ultimately technology from Theo, for instance, is to then go, okay, but yeah, 1 minute past that phone call, or 2 days past that phone call, or 3 weeks past that phone call, what happens there? And from our point of view, access can replace that phone call. Access is the ability to be able to input that data and get an outcome and find the right pathway earlier. So
yeah. I'm going to guess too that given that you mentioned, there has been a lot of interest and demonstrable ROI from the employer or payer's perspective, and
sounds so sinister, the demonstrable, doesn't it?
I like the word. I want to use it. The
word.
It's on my list of words I like to use. The but given that you've got the ability to engage with patients more frequently, I would imagine, or consumers, the from an employer's point of view, they have a duty of care, but they've also, depending on the, I guess, industry, to have someone who's out with a injury or who's incapacitated or requires intervention and perhaps has left it too late because they have not either been inspired to or even just physically capable of going into a physical traditional bricks and mortar clinic.
Yeah.
Are you seeing that there's better results from an early intervention point of view as well?
Yeah, I like the fact that you can throw something up and I can. So yeah, 14-1 ROI was delivered based on this exact premise, in the sense that if you can get somebody to access their healthcare quicker and understand, and we get to understand their condition quicker, then you can get them into treatment quicker, either in a self-management environment or a face-to-face environment, whatever that treatment pathway is. Again, like I said, I'm not ideological in regards to whether it's digital or face-to-face. But if you can get access, so our FEO access product, in front of that patient, worker, employee as soon as possible, then ultimately you're going to get them into treatment quicker, and therefore the return on investment, the outcomes clinically are going to be better. Everybody's going to win out of that scenario. And that's what we were seeing within kind of the pilot in the Australia market, was this idea that people were triaging so much quicker. Like this idea that you hurt yourself on a Monday afternoon, you could be in our product 5 minutes later. You could be onto treatment pathway by that evening. You could be doing exercises the next day and for the next 12 weeks if necessary. And you could be back to work the same day. Like, you could carry on working. You wouldn't even need to come off work, if you see what I mean, because realistically you'd caught that injury so much earlier in the cycle of that injury that you weren't incapacitated, but you had a bit of a niggle in your shoulder, or you had a bit of a niggle in your back, or something was kind of, saying, well, something was not quite right here, I need to get care about it. But if you waited, or you said, oh, I'll put that off because it's either too kind of it's too much of a hassle, or the clinic's too far, or I don't want to take time off work, or I'll take some kind of painkillers and it will go away on its own, and things of that sort, and you don't bother accessing anything because it is too much of a burden on you, then ultimately, yes, of course the condition's getting worse, and then ultimately not only the amount of time that you're spending off work and the cost of your business and generally the economy is creeping up, but also you as the individual are now, you're having to spend time at home, or you're having to claim on workers' comp, or whatever the kind of mechanism is, depending on where you are in the world. And that has a comorbidity risk. Your mental health is going to suffer because of that. I know personally, I've, definitely seen a link, from an individual point of view, of if I am off work because of a bad back, or I've got very severe pain for something related to MSK, the impact that has of me not being able to go out for a walk, or walk my dog, or place, I don't play a lot of sport, but go out and kick
if you
a
wanted
ball.
to.
Well, yeah, exactly. If I wanted to become a world-renowned international sports star, then this is limiting. This is limiting my ability to fulfill my potential. But like, play with my kids and do all those kind of things that are so important to my mental health on a day-to-day. And so, yeah, I think it's really important that we don't underestimate this link of getting people into care quicker helps in a number of ways. And yes, I'll talk to the money side because I am a CEO and I'm also a commercially driven health tech leader rather than necessarily clinical, because I have great clinical co-founders. So I will look at the impact on the economy. I will look at the impact on a payer, on a workforce, on a employee or employer basis. But, I think, again, to the top of kind of our chat today, a lot of those things get kind of sidelined sometimes because everybody's hyper focused on the clinical side, and that's the right thing to be focused on. I'm not saying that it's not. But also, if you want to have impact and you want to be able to deliver all of these great things, you need it to work commercially and economically and things of that sort. And so I think it's really important that we're focusing on helping people stay in work. And there's always this focus on getting people back to work. And I'm like, maybe they didn't even need to leave work in the first place if we can get them early enough. Like, why can't we support them in their workplace? And so we're seeing a lot of that. And we do that as skill, basically. And that's kind of the great thing about FEO and kind of what we're trying to drive internationally now.
And I think about, as this plays out, and in this world of everything becoming AI, and all jobs are changing, and the world will be different. The looking at different clinical modalities, I think of anything musculoskeletal, like physio and all of that. There's still a lot of human intervening that needs to be done, and that's a patient's expectation at certain periods within that patient journey. But how do you see it, over a longer period of time, this whole world of MSK and the different treatment options, the role that digital plays, like over a longer period of time? Where is this all heading?
Yeah, it's a fascinating question, and I think it's whether it's MSK or healthcare generally. Like, I am, as you can imagine, a very big in the tick box of what technology can do for healthcare. Like, we have an ever increasing healthcare problem with a diminishing amount of people that to be able to deliver that care. Those two things collide, and it doesn't look pretty. Especially kind of, obviously I'm much more acutely aware of the UK problem, but just globally, like the amount of people that are clinicians versus the amount of people that are in this world and ever growing, and the amount of people that can then get access to healthcare. And that's not even to say the countries that don't have great healthcare systems. And I think Australia has a great healthcare system. I think the UK has a great healthcare system. They just need a little bit of support in certain areas to be able to deliver that great support that they currently already have. Where do I see it going? Like, I think AI and kind of the role of AI in healthcare is going to be growing. It's not stopping. The Pandora's box is open, let's say, in regards to what the art of the possible is. I think safety is something that scares the hell out of me within AI. I run a digital business. Like, we look at AI on a day-to-day basis. We don't deploy it on patient-facing tools yet. We've got stuff in the background that actually we could deploy very, very quickly, but we want to make sure that's safe. We want to test that at scale. And we want to make sure that from our perspective, what I would classify as black box systems, in other words, systems that you can't see inside of, we understand how that's making decisions, and how that's impacting outcomes and lives. And, this is not customer services. This is not making sure that you got extra cheese on your pizza. This is not making sure that, day 3 of your holidays itinerary is properly planned. This is somebody maybe given drugs, somebody maybe getting advice that ultimately may have real world, life-changing results on that. And so from my point of view, not only does the kind of technology need to be understandable, it needs to be explainable, it needs to be safe, obviously. But then also I think it needs some oversight. And this is where I need to be careful. As a tech CEO, I'm almost like, yeah, but I don't want too much, because ultimately that stifles innovation, stifles growth. But there has to be some happy medium there. There has to be some medium around making sure that things are safe, making sure that what we're scaling here is good for humanity. I think there is a kind of workforce conversation to be had. Like, if we're replacing X, Y, and Z, whether it's clinicians or workforces, what is our responsibility as tech builders on that workforce replacement? Where do they go? What do they do? What does that look like for the economy? And I think that too much is said a lot of the time about value creation, rather than necessarily human value creation. Like, is this building value for the world, or is this building value for, I'm not trying to sound like I'm like a socialist, like I'm a CEO of a health tech business that's trying to make lots of money and things of that sort, but I'm also very acutely aware that we're trying to solve problems for 2 billion people with MSK conditions, but are we adding to a scenario of poverty and creating kind of wealth disparity with some of these big AI kind of technologies that are coming out there? But let me be clear, they will also solve our problems. We just need to understand how to harness them correctly and sustainably, and sustainability from a economic point of view, but also a human perspective. How do they help humanity, and I think in healthcare they can. There's no doubt about it. And we're seeing firsthand that digital, not necessarily just AI, but digital, can really unlock scale and capacity and price
Yeah.
and so yeah,
I
really
think,
excited.
I mean, we're very aligned in terms of that concern, and or at least approach towards that reality where that increasing, or that divide will continue to increase around wealth disparity and all these bits and pieces. But one would hope that if we can harness that hype and the interest and the investment into some of these solutions, but then perhaps point that charged up rocket towards issues that really need to be addressed in healthcare that actually can, move the needle, and other cliches. I feel like that's still a good thing, and we'll let the tech bros continue to try and optimize their longevity and whatnot. But at the same time, we can also address access in rural and remote areas, and
Yeah.
just general health literacy and stuff like this, which is super important.
And they can work in tandem. By the way, I'm not. I don't think that there is necessarily this world where it goes exactly like that. The idea that, for instance, there's 2 billion people globally that suffer with MSK, but imagine the cost on the healthcare systems where those people live when there isn't access and when there isn't faster kind of routes to treatment that Theo's delivering in our communities now. But like, imagine that there isn't that, which ultimately is with, we're not global. We're not in every household. So there still is large amounts of the world that we have to go and kind of win over and get your technology in. But imagine a world where, yes, there's 100,000 people that need access to a physiotherapist and they can't get it. They have to wait 12 weeks, 18 weeks to get a physiotherapy appointment. And as a result of waiting that much time, their condition has gone chronic. They now cost 10x, 15x to the healthcare system because they didn't get access quicker. Well, there's an obvious then solution that if you can get them into access quicker, then they're going to be cost less. And then the whole healthcare system benefits from the fact that 9x, 10x, or as our pilot showed, 14x money didn't need to necessarily be spent because they got access quicker, or they were allowed to stay and work. The economy benefited from quicker access. And so I do think that there is this really kind of interesting that it can still be across people that can't afford to pay, for instance, or can't, don't have all singing, all dancing health insurance, and that actually is a government responsibility to a certain degree to look at some of these tools and go, look, this is just a good delivery of investment. It's going to save the economy money, therefore the government money, therefore tax, and therefore the workforce and everything else that comes off the back of that. It doesn't need to be private medical insurance fully funded. You have to spend $200 a month on health insurance to be able to get this product, or have a copay of $50 or $100 to go and see somebody to be able to get access to these tools. I think the great thing about technology is that it can be scaled, and it can be scaled much cheaper than trying to pay it full whack. So yeah,
and I feel like as the accuracy and adoption and trust all kind of continue to scale, at some point we'll tip where it'll be irresponsible not to invest in some of these solutions.
That's pretty fun.
That's what we're striving for. Hey Jason, I feel like we could chat for a while, but as we start to round out the conversation and think about directionally where EQL's going, what's on the radar for you, and what are the priorities? What can we look forward to seeing over the next 6, 12, 24?
Yeah. So we're obviously a UK based business originally. We've branched out and actually with our partners in Australia, Recover, obviously Marsh business, or Mercedes. We've scaled into Australia kind of quite nicely. It's early doors, but we've just finished our pilot with a global leader in HR that delivered this great ROI that we were talking about earlier. On the back of that, and ultimately kind of wanting to push into the market, we've successfully landed 3 new clients. happy to announce that by the time this recording comes out, we will be live with all three, I believe. Sydney Catholic Schools is one of the bigger ones. So 12,000 teachers and staff of Sydney Catholic Schools, 147 schools they represent. We're supporting them with giving access to our great tools to support them in their great mission to kind of educate Australians youth, but also do that within an MSK kind of free zone, hopefully, and being on your feet all day as a teacher or as a grounds person or as a support staff, they have high prevalence of MSK conditions. So we're really pleased to be supporting them. Those all go live in kind of the next week. Some of them are already live, some of them are going live, and we're looking forward to supporting them. We're really pleased to be working with them, and scaling then from there is ultimately where we're heading. So the data that came off our first pilot with the HR leader showed not only the outcomes, but also the ROI being delivered. We're really excited to be launching with these three new kind of partners in the next few weeks. We're really excited for the Australian market. And actually, from our point of view, we're sinking a lot of not only resources, but staff. We've got on the ground staff there now, which is great to see. Helps me with my late night calls and having the ability of time zones not being necessarily the biggest thing in my life. And so, really pleased to be scaling into the Australian market. And I'm really excited not only for Australian healthcare generally, but I think that you have some unique challenges. Scale is one in terms of size geographically and funding and things of that sort, but also the passion that I see from kind of Australians in regards to helping not only their fellow man, woman in terms of being able to kind of get access to these types of tools, but also I think that there's a willingness within the payer community to really adopt and look at these kind of things. And a lot of that's post-COVID. We all had to make those changes as a result of post-COVID. But I think that the Australian market, maybe because of the unique challenges of rural and size and their acute awareness maybe of things like First Nation accessibility and things of that sort, and their willingness to adopt then things that help them address kind of some of those challenges that they have within those communities, means that we see a really vibrant kind of place to land and build Theo and scale equal across the Australian continent. So really pleased to be working with Australian partners and scaling that and delivering great healthcare to Australians over the next.
Well, I mean, those reference sites, they're not immaterial. That's huge. But I guess that doesn't come through luck. That comes through, as you say, demonstrating the impact and looking forward to seeing that continue to scale. So, look, Jason, I appreciate you making the time to have a chat on the show. We'll make sure the details for EQL are in the show notes of this episode, and people can check that out and learn more about what you do and follow along with that journey. So, looking forward to catching up in some random neutral country.
We'll find somewhere in between, I'm sure. In fairness, I believe I'm in Australia. I'm trying to get out there early Q1 or maybe early Q2. I'll make sure that stop in and pop in.
I could be there, or I could be in some random country.
That's the problem. It's tracking you down or nailing you down to a location is probably more hard with me. I'm a relatively kind of in position person. You, on the other hand, social butterfly.
Oh, look, I try. But it's spreading the word, getting the global word out, one conversation at a time. So, Jason, I really appreciate it. Thank you so much.
Thanks a lot for having me.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.